Hello, I'm Yiklam Serena Ho. Today I will be talking about overweight and obesity in Hong Kong and health promotion interventions. So in Hong Kong, approximately 20% of the teenagers aged 12 to 18 are overweight or obese. A BMI of 23 kilograms per meter square is considered as overweight and 25 kilograms per meter square is considered as obese. The definition is different from the WHO due to global fat distribution and variance. Over the past decades, teenage boys have had a higher rate of overweight and obesity than girls due to a greater energy excess between energy consumption and energy output in body metabolism and physical activity. Since COVID-19, the annual assessment has been stopped, so 2021 to 2022 data cannot be obtained. Speaking of the factors leading to the problem, other than family history of obesity, personal taste and perception on food also dominate the eating behaviors. Multiple research indicate a sharp rise in detection of obesity result from increased food consumption during COVID-19. And in terms of relationship, the reason to unhealthy behaviors are the lack of availability of healthy food at home, household economic difficulties, and also parents' eating habits. The social separation during COVID-19 also promote more sanitary behaviors at home in adolescents. And in terms of community, the massive advertisement on TV and social media on unhealthy food also contribute to the problem. Many of the food industry will only import and sell unhealthy food because of there's no penalties. Therefore, they will meet the demand of the population selling these kind of food. And research also indicate that there are 70% of high school in Hong Kong were surrounded by at least one fast food restaurant within 40 meters. Therefore, the obesity trend can be explained. For social and political factors, during the lockdown, schools and sports centers were closed. Teenagers has limited places for exercise. Besides, Hong Kong has the potential to develop food insecurity because we heavily rely on international food imports. To improve public health and disease transmission, the government cut down 80% of the farms. The lack of local production has led to a low price of local food and agricultural products. Also, nutrition labeling is not required for freshly manufactured products or restaurant food, making it difficult for citizens to identify healthy food. Since 2006, the Department of Health has started a program called Eat Smart at School.hk in primary and secondary schools to reduce children and adolescents' obesity and illness risk. Activities consist of Eat Smart School accreditation scheme, which helps schools to create a sustainable, healthy eating environment. Salt reduction scheme for school lunches to collaborate with lunch suppliers to reduce 5 to 10% of sodium content in school lunches every year. Joyful Fruit Month to promote fruit consumption and nurture fruit eating behaviors. Nutritional cooking training workshop for chefs aims to encourage school lunch caterers to follow the nutritional guidelines on lunch designing. So speaking of the evaluation of present health interventions, we use the Ottawa Charter for Health Promotion. Under building healthy public policy, other than the previous description of food importation, test-friendly environment, and also food labeling limitation, it is also found that the Eat Smart at School Hong Kong schools, 70% of the schools had not documented their healthy eating policy or had created any. So to effectively combat the problem, it is needed to monitor the compliance of school in creating healthy eating environment. It can also be improved by creating a supportive environment. Some study indicated that the participant rate of this program is really low, and the results showing students' obesity reduction are very similar in the accredited school and non-accredited school. So more incentive and also training, not limiting to guidelines, should be given to school and school operators to encourage them to join the program. It can also be improved by creating a supportive environment. Some study indicated that the participant rate of this program is really low, and the results showing students' obesity reduction are very similar in the accredited school and non-accredited school. So more incentive and also training, not limiting to guidelines, should be given to school and school operators to encourage them to join the program. Dietitians and also health organization in the community also need to participate in the program because an assessment by the government pointed out that school lunches by the supplier did not follow the nutrition and school lunches guidelines, including limited food items, and strongly discouraged food items in the school lunches. Therefore, enough dietitians, consultations, and also training to the lunches suppliers will definitely improve the quality of students' eating. More in developing personal skills, a cross-sectional study in 2007 shows that a weak correlation between nutritional knowledge and snacking eating behavior in secondary school students. Participants were asked about the aims and messages promoted by the Department of Health, and they showed sufficient understanding on them, but still they have snacking behaviors because of the taste and the price. And given that many healthy snack recipes are provided in the government website, I suggested that school and also parents can follow the instruction to make snacks for their kids. However, there are no studies showing the number of views and also successes on the recipe. Lastly, health service orientation on school health services are reported to have limited services, namely follow-up body check, inform parents with results, and also health training to students who are needed. They are all account for 20% of the school providing these kind of service, and the voluntary student health services provided by Department of Health also reported low participation rate because many students want to skip the assessment to master their unhealthy lifestyle, which also limited the accuracy of many studies. And there are 3 improvements can be done to increase the effectiveness of the implementation now. Number 1 is the mandatory home economic lessons in lower secondary school educations, because we have voluntary HE lessons in secondary school but not mandatory after the education reform in Hong Kong. where it is categorized with cookery and also sewing. So reinforcing cooking lessons with more dietary education on food labelings and also healthy food choices can definitely increase the understanding and also practical skills of students having healthy eating behaviors. So the teachers are receiving trainings by the dietitians, and they can bring back the knowledge to students in the class weekly by demonstrating the dishes, how to make the dishes, and use the menus from the government website. And the dishes and recipes can be shared with parents and their carers when students are finished schools and going back to home. If possible, the fresh and raw ingredients can be provided by the local farmers, which can facilitate the production values and reinforce the importance of having local food production. Number 2 is the mandatory school lunch for lower secondary school students, aiming 12 to around 15 to 16 years old, because they are not as mature as the higher form students, and there are a lot of fast food restaurants around the schools. So forcing them to have lunch in the school with the lunch provided in the cafeterias and also canteen may be joined with the salt reduction scheme. Their eating behaviors can be improved and also their physical health. Lastly, monthly FFQ can be distributed to all forms of students with selective follow-ups by the school dietitians or nutritionists. They can review the eating behaviors and also the food consumed by each student and pick up those who are high risk in obesity or overweight to meet them to have an interview on a more detailed information of food intake and advise them with healthy recipe. So more about the evaluation on students' eating habits and food consumption are written in the essay and also PowerPoint. Basically, they will be asked to interview with the teachers and also dietitian if they are more prone to obesity or unhealthy eating lifestyles. Parents are also invited in the interview because they demonstrate a very important role in the eating style alteration. Thank you. This is the end of my presentation, and here are the references.